Hi, I'm Will Deutsch, and this is Mobility by Density. Using interventions targeting physical and digital infrastructure at varying density levels, there are opportunities to improve mobility in aging populations. These changes to infrastructure aimed at specific density levels have potential to increase access to services, lower levels of social isolation, and improve overall health. By now, we are all probably aware that the elderly population in the United States and worldwide is increasing. Statistically, aging populations have increasingly lower rates of optimal mobility. This affects aspects such as walking, operating motor vehicle, as well as things like access to internet or use of a smartphone. Optimal mobility is simply defined as relative ease and freedom of movement. Those who lose optimal mobility are less likely to remain in their community, have higher risks of disease, poorer quality of life, and in general have worse health. So far, we've been discussing mobility in terms of physical movement and use of physical infrastructure. But optimal mobility should be viewed as a combination of both physical and digital infrastructure. Looking a little more closely at how physical infrastructure affects mobility, it can be seen that it can be broken down into three major categories moving from a macro to micro scale, all the way from zoning down to things like small objects at the street level. Interventions to digital infrastructure can be broken down into categories of access, education, and affordability. What is critical to understand is that different density levels, both built density and population density, greatly determine which types of interventions are effective in certain locations and communities. By analyzing density levels, we can determine if it is more efficient to invest in physical or digital infrastructure to attempt to impact mobility in aging populations. Rural areas are characteristically low in density. In these locations, it is often extremely expensive and difficult to improve physical infrastructure. Because of this, a focus on digital infrastructure is much more effective. On the other hand, in urban, high-density locations, small changes to physical infrastructure can greatly impact things like walkability and improve mobility for many. Looking a little bit more closely at urban context, most interventions are aimed at improving walkability, developing or altering public transportation options. Large-scale interventions to things like zoning to promote mixed-use neighborhoods can have a large impact on walkability. Additionally, changes to circulation options such as increasing bike lanes, sidewalk size, and public transportation can play a major role. Also, small changes to streets like adding objects for resting or using restrooms can improve walkability immensely for aging populations. When we're trying to figure out what is realistic and feasible, the greatest opportunity is in adding objects like seating. This is the kind of intervention that can happen immediately and doesn't require complete alteration to the neighborhood. Let's take, for example, this hypothetical street section. By designing new bus stops that provide protected and safe seating, walking distances can become a fraction of the length, greatly affecting the overall walkability for elderly populations with minimal financial investment. Moving back to rural, low-density locations, as discussed before, the aim is to improve digital connectivity. Increased digital connectivity can result in higher community engagement and greater access to online services for mobility use. Out of the three areas of access, education, and affordability, most individuals lack education in terms of how to use digital platforms or cannot afford services. Because of this, there currently exists some services such as the Lifeline program, a government-funded program that subsidizes internet costs for low-income households and individuals. Out of the current elderly population, 40% are eligible. I believe that expansion of services such as these to include education, one of the areas elderly struggle with the most, would greatly increase mobility for elderly populations. While this is aimed at rural communities, it would likely impact individuals all the way across the density scale. Now, circling back to our original design to outcome statement, we can see that more specific design interventions based on density level can result in varying outcomes, all of which influence optimal mobility. Small-scale objects, like properly designed bus stops, can result in greater walkability, and social programs to improve internet access and fluency can improve digital connectivity. While these interventions are not all-encompassing, it is clear that it is critical to analyze density relative to digital and physical infrastructure to try and impact mobility for aging populations as they continue to increase in the United States and worldwide.